It's time now for 8-1 for your health check, brought to you by Gloria Gates CARE. We are joined alongside Rhonda and Chelsea, care advocates over at Gloria Gates. Ladies, thank you so much for hopping on today.
Thank you for having us.
So you two are here because October is Health Literacy Month. And we've sort of been talking about how you two are sort of the first touch points for the new members. But we also kind of want to talk about just encouraging patients to take an active role in their own health care just throughout their daily routine, throughout their daily lives, and that's something that you can help out with as well.
Yes, we're wanting patients to take an active role in their own health care. I mean, we're here to help, we're happy to help, but we can only go so far. So basically, just by informing the patient, it's educate, educate, educate. But as far as the patient taking on their own role in their healthcare journey, it's important that they educate themselves, but carefully, because there's a lot of misinformation in the media, obviously. We find that with everything, but especially healthcare. But another thing they could do is they can just bring someone that they trust with them to their appointments. That really goes a long way, in my opinion, just to have someone there with you that you can say, hey, we're gonna figure this out together. And then obviously to just make sure you're being compliant with what your doctor's telling you, taking your medications as prescribed, no overuse, no underuse, things like that. Being healthy, exercising, just staying away from bad foods. That's all stuff that the patients can do on their own without us telling them.
And you don't want them to feel like they're alone. We got them. We're here for them. We got you. We'll do everything we can. You're not alone.
Their team is making sure you're covered no matter what over at Gloria Gates CARE. But you mentioned having a family member maybe at some of these appointments, working with some of you guys, but you also have to look at it from the other side, where sometimes you might see a family member kind of, sort of take the reins with handling someone's health care, but it's sometimes really important for, you yourself to make sure that you're getting everything you need. Is that right?
Absolutely. Yeah. I mean, like I said, as far as us at Gloria Gates CARE, we're here every step of the way. And I'm sure you have family members or friends who care about you in that way too, but like I said, we can only go so far. We can only push you so far. You have to take control of your own health, and you have to educate yourself in a lot of ways.
I think another important thing to really talk about is organizations improving health literacy, right? Whether it's at your job or school or just any community you're involved with, it's important for those communities to get together and improve on health literacy as well. It is.
It's nice if we all kind of worked together. But here at Gloria Gates, we focus on the ones that come to us, become members, become patients, and we educate, and we make weekly or monthly or bi-monthly calls to them depending on what their situation is. So we're constantly checking in, we're constantly like, hey, how's things going, what's happening? And once you get that trust, they spill, and the literacy is a big thing. We're there if they need us to just fill out regular papers in the office, or whether they want us in the office, in their appointments, we're there for them.
Yeah, getting that trust is such a big thing. It's kind of, they need to really overcome that barrier, but that's where you ladies come in. You're kind of the first touch point that these patients are going to be working with, and then, yeah, like you said, you're going to be able to help them by them helping you with just, again, building that trust. So what are just maybe some of the most important things, the biggest things that patients really need to understand about going through the process with you guys?
I feel like as a care advocate, one of the things we want them to understand is after they get through the enrollment process, they're solely in our hands. So basically, we have to be committed to making sure they're following up with their appointments, they're taking medications, they're getting the referrals that they needed, they're showing up to these appointments. every step of the way, we're there saying, did you get this done? Did you make sure this was taken care of? It's just, I feel like we say it so much, but like it's like a whole team approach. Like we're always working alongside the doctors, and if we as care advocates have questions, we're going to the doctor and we're saying, hey, could you help me out with this? We work with the mental health team at our office. We work alongside the dietitian. There's just so many different avenues we can take for the patient to make sure their literacy needs are being met. And we're actually teams. So, like, one patient care advocate is assigned to 2 doctors. Another patient care advocate is assigned to 2 more and 2 more. So we work in teams. Like, I would always be in contact with my PA or whatever that I'm working along with my medical assistant, the nurse. So we all work together and say, okay, this is what happened in the office, and the medical, nurse says, okay, da-da-da-da-da, and then I come in with my input. So we're all working together on every individual, but we're in teams.
And it really is that all-inclusive approach, all in one. And if you're interested in Gloria Gates CARE, we have plenty more information over on our website, WTAJ.com/Studio 814, and just click on that Your Health Check tab, and you can learn much more about all that Gloria Gates CARE has to offer. Thank you so much, ladies.
Thank you.
For having us.
You're welcome.